Hello everyone, welcome to Clinical Knowledge and Medicine. This video is about failure to thrive. This term means retarded growth. In last two videos we discussed about growth hormone deficiency and gigantism and acromegaly. These are growth related disorders. So some other factors other than growth hormone responsible for the growth of newborn. Definition of failure to thrive is it is term used for infants whose rate of weight gain is sluggish. Length of child may or may not be affected, means slow weight gain is there. Causes of failure to thrive. Intrinsic factors are defect in absorption because of celiac disease, lactose intolerance, cystic fibrosis, persistent vomiting, pyloric stenosis, gastroesophageal reflux disease, metabolic disorders, diabetes mellitus, galactosemia, adrenal hyperplasia, chronic disease of heart, lung, kidney, liver, etc. Extrinsic factors are inadequate nutritional intake due to faulty maternal nutrition, deficient food intake, poor health during pregnancy, inadequate lactation. Social and environmental deprivation due to early separation of mother from infant, depression in parents, family disaster like death in family, unwanted child, single parent, young mother who is unable to care for the child, and psycho mother. All these factors can lead to failure to thrive. Clinical features: infant looks small according to age, weight is below third percentile, wide eyes expression, expressionless face, and avoids direct gaze. Vocalization is delayed and response to social stimuli is inadequate. Child shows lack of cuddling, assumes infantile posture with clenched fist, thumb sucking. Management: treatment is both long term and immediate and directed to infant and mother. Hospitalize the patient for 10 to 14 days. Infant with non organic cause improve in 4 to 5 days. Otherwise, organic cause is suspected and investigated. Nutritional problem should be managed. Feed should be thickened to increase calorie intake. Infant should be fed in the semi upright position.